exposed, inspect from in front, the side and from behind. Note any deformity, for example, abnormal curvature. Look for soft tissue abnormalities, such as hairy patch or lipoma, that might overlie a congenital abnormality.
I'm now going to feel down your back. Let me know if it's sore anywhere.
Palpate the midline spinous processes. Note the overall alignment and any focal tenderness. Increased prominence of one or more posterior spinal processes can be due to collapse of the vertebral body anteriorly. The L4-5 interspinous space is at the level of the iliac crest.
And again, let me know if it's sore.
Feel for tenderness in the paraspinal muscles. You may also notice areas of increased tone.
Now I'm going to tap over the bottom of your back. Let me know if it's sore.
After warning the patient, lightly percuss the spine with your closed fist and note any tenderness.
Just sit down on the couch for me and cross your arms. And now I'd like you to look towards me, rotate towards me.
With the patient sitting, the pelvis cannot rotate. Look for rotation between the shoulders and the pelvis. Almost all of this occurs in the thoracic spine. Next, flexion, most of which happens in the lumbar spine.
I'd like you to keep your legs straight and bend over to touch your toes.
Record how far down the legs the patient can reach.
And take a step forward. Now, lean back as far as you can.
Extension, again mostly lumbar. Normal is 10 to 20 degrees beyond vertical.
Now face me. And now I'd like you to go down to the side like that as far as you can.
This tests lateral flexion. Ask the patient to reach down each side, touching the outside of the leg as far down as possible, keeping the leg straight.
And turn round.
When examining forward flexion of the spine, it is difficult to separate this from hip flexion. In Schober's test, we isolate the component in the lumbar spine. Mark the skin in the midline at the level of the dimples of Venus. Use a tape measure to draw two more marks, one 10 centimeters above and one 5 centimeters below the initial mark. We refer to the upper mark as B and the lowest mark as C. Place the end of the tape measure on the uppermost mark B and ask the patient to bend forward and touch their toes.
Now keeping your legs straight, bend over to touch your toes.
The distance between B and C should increase from 15 centimeters to more than 20 centimeters. Now we move on to the straight leg raise to test for tension in the L4, 5 and S1 nerve roots. With the patient lying supine, lift the foot to flex the hip passively, keeping the knee straight.
Tell me if you get any pain at any stage.
Determine if there is a limit caused by pain in the thigh or leg. It's normal to reach 80 or 90 degrees from the couch. If a limit is reached, support the limb just below the limit.
I'm just going to bring your foot up. Let me know if that causes any discomfort.
Pain due to nerve root tension should be reproduced by dorsiflexing the foot. For the tibial nerve stretch test, flex the knee and hip.
I'm now going to bring the leg up again.
Then gently extend the knee so that the tibial nerve bowstrings across the popliteal fossa.
Let me know if it's painful.
Press over the hamstring tendons at either side.
Is that sore?
No.
And then over the nerve in the middle of the fossa. The test is positive if pain occurs when the nerve is pressed, but not the hamstring tendons.
Now could you roll over onto your front?
Lie the patient prone for the femoral nerve stretch test.
I'm just going to bring this leg up.
Flex the knee and then extend the hip. This stretches the femoral nerve.
I'm going to lift this leg. Let me know if there's any pain.
A positive test causes pain in the back or front of the thigh.
And roll over again. Thank you very much.
Hello.
Hello.
My name is Dr. Punekar. I'm your MRCP examiner today. This is Station 1 Neurology. Would you like to come through, please?
Yes.
This is Mr. Waddington. He has been referred by his GP for a visual disturbance. Please examine his eyes neurologically.
Hello, Mr. Waddington.
Hello,
My
nice
name
to
is
see you.
Gary. I'm one of the doctors.
Right,
I've been asked to examine your eyes, if that's okay.
that's all right with me.
Okay. Can you see me at the moment in front of you?
Yep.
Okay. I'm going to ask you to cover one of your eyes for me, sir.
Right,
Okay. Either eye's fine. Okay. Can you see how many fingers I'm holding?
2,
Okay. And now?
4,
Excellent. And could you cover your other eye for me, please, sir? How many fingers now?
4,
And now?
5.
Excellent. Thank you very much. Do you normally wear glasses, sir?
Only for reading, driving the car and watching television.
Okay. I would like to use a Snellen's chart to formally assess his visual acuity.
Okay, that's fine. No, you can go ahead without it.
Okay. Thank you very much. Okay. Now I'm just going to test the movement of your eyes, if that's okay.
Right,
So, if there's a... I'm just going to come to your level.
yep,
Okay, and I'm going to ask you to look straight at me while keeping your head still. I'll ask you to follow my finger with your eyes, okay, and let me know if you see double.
right,
Okay, so please follow my finger with your eyes.
double. 1, 1, 1, 1, still 1, 2,
Two. Okay. Can you look again at... You see two.
still 2,
Okay. I'm going to cover this eye,
right,
okay, while you're looking at my finger. Let me know which image disappears, if it's the nearer one or the one further away from you.
neither yet.
Neither, okay.
Yeah, the one nearest to you has disappeared.
The one nearest to me has disappeared. Okay. Thank you very much.
Is that it?
Not yet, sir.
Oh,
But it does indicate you have weakness of one of your eye muscles.
right,
I'd like to complete my examination by examining your eyes further, if that's okay.
yeah,
Okay. I'd like to look at the reflexes in your eyes in response to light. I'm just going to shine a light in your eye, looking for the response.
right,
Okay. We shouldn't cause you any harm. Okay. But you will. Some people experience some discomfort.
okay.
Okay. Shining the light now.
Do you want to follow it?
No, no. Just look straight ahead. Thank you. Thank you. Thank you very much for your time, sir.
All right,
To complete my examination, I'd like to do a fundoscopic examination.
Okay.
Ideally, do Snellen's chart assessment as well
Okay.
as time allows, a Chihara color test.
Okay.
I've completed my examination of this patient's eyes from a neurological point of view as requested.
Thank you.